You are watching the Swiss Startup Tour on CNN Money Switzerland, where we are getting to know female founders and entrepreneurs from all over the country who have decided to embark on their own startup journeys. Today, I'm joined by a lady who went the way of Medtech, but for horses. Dorina, Thiess, CEO and co-founder of PIAVITA. Thank you so much for joining us.
Thanks for having me. It's a pleasure.
I've got one of your main clients back in the back wall there.
Yes.
Okay,
it is.
It's quite niche, I would have to say, but a market that, as I understand it, goes into the multi-billions.
Yes, absolutely. So a lot of people think equine is still a niche. Equine is specific, veterinarian also. But it's actually not anymore. The equine veterinarians scene grew immensely in the last years, and the spendings and investments into the equine industry is massive. So the global economic impact of equine industry was 300 billion in 2016, and it's growing every year.
I can imagine that's a big selling point for investors.
It is definitely a market worth considering going to.
All right, well, we're going to talk about that more in a moment, but let's talk about exactly what it is you do, which is this device, which is a measuring device for, of course, as we've talked about, in principle, for horses.
Yes, exactly.
What does it do?
So the measuring device is basically the core unit with which we started. So it has various sensors in it, two that came out of our very own development, and we complemented that with additional sensors, and it enables measurement of medical vital signs through the fur of the animal, of the horse. So it doesn't even recognize that there's anything going on, which on the other side enables the veterinarian to do diagnostics without having to be with the animal all the time. So on the other side of the whole system, there's the whole software that provides the veterinarian with deep insights into the well-being of their patients. And then there is the middle layer that actually transforms the vital signs with machine learning and AI to have a very, very high precision level of those vital signs that we detect.
So it does sound like you are you're really shaking up the veterinary industry with something like this.
We definitely are trying. I think we are pushing a lot the whole digitization in the veterinary industry because there is not a lot there yet. So with this whole system, we're really trying to let the veterinarians think about the efficiency of their work. If they're actually doing the work that they are supposed to do, namely treating animals, diagnosing their patients. But what they mainly do is running around with clipboards or driving in their cars instead of spending their worthy time with actually their expertise and what they were trained for.
I mean, it sounds like it would be an easy sell to veterinarians, but is it?
Well, it is also a cultural point because, as you said, we are shaking quite a bit. Yeah. So as in every industry, digitization takes a little bit of time, and it also takes the people to rethink what they're actually doing and how they can become better. So obviously we are asking the veterinarian also to change the way they were working for decades. We now are happy and proud that we have a lot of veterinarians who were absolutely willing and embracing to do that. So we feel, okay, this whole thing is now rolling more and more, but it will still take some time to have like those early adopters and those movers in the industry to really be the first ones to adopt and to bring the whole industry forward a little bit.
Because of course, with any disruption and any digitalization, you also have costs. So I know this thing costs around 3,500 euro, right, per device and the belt, because this is the belt, right? This goes around the horse. You put the thing in there. So it's not a small investment. Do you find that that's also an issue? Like that people don't want to invest in new processes?
Well, from a medical perspective, it's not that big of an investment. So if you look at other medical diagnostic systems, they are actually way higher. But what we really are asking the veterinarians actually to equip their whole clinic with a digital system. So obviously it's not exactly that's not only one system, but it's really about thinking about connectivity in their stables, having remote monitoring of ICU patients. treatments, having remote monitoring and long-term monitoring also of if infectious diseases, for example, to just be more proactive instead of reactive. So normally they always treat their patients whenever they show it, which is very late in the process, because as an escape animal, they are rather trying to hide whenever there's something wrong.
As an escape animal.
Exactly.
Horses are escape animals.
Yes, they are.
Why? What is that?
Well, we are predators to them. Every human is. So every veterinarian that is coming, they will definitely try to hide any weakness that they have to, well, secure themselves, right?
Okay.
So if they are feeling pain or if there's anything wrong with them, the moment we see it, even as their owners, who sometimes have a very strong bond to their horses, but still, even for them, it is very late. So the pain must be really bad already when they show it to us. So all the treatments that we do are very reactive. And we are trying to basically give the horse a little bit of a voice without them realizing it. So we can do measurements without interfering with them. We can diagnose them from afar. We can keep them calm. We can even keep them in their natural surrounding, in their own stables, and not drive them around the country or in the clinic back and forth and from one vet to the next. But we can really do a lot of treatments right out in the field.
And in terms of other applications, I mean, you can also use them to kind of assess the state of a horse, which, you know, then that gets you into the entire market of horse ownership and buying and trading and selling of horses.
Absolutely. That is one of the most fascinating parts of our job right now, I would say, because we just give them the tools, but we don't tell our customers what exactly to do with that. We can give them recommendations, obviously. We can refer to applications that others are doing with it or diagnosing things, but they really take it to completely different fields. So we have veterinarians using it for ICU, like I said, post-operative monitoring, but some also for purchase investigations, for example. If the owner really wants to have a better insight about the well-being of the horse they're about to buy, which can be a huge investment. We have breeders who are using it now to check on the well-being of the mare. We have also now rehabilitation centers, so it's all going into more performance and improvements of performance and things like that.
And can you use this for other animals, or is it just horses?
No, the technology basically enables vital sign measurements through layers. So that is the core of it all. It doesn't have to be a horse.
So you and I could also use this?
Absolutely. I have so many measurements of my ECG already, so you can easily do measurements on yourself, on a dog, on a cat, on a zebra we had it, on donkeys, obviously, all those different kind of animals. It's just for us as a startup, it was very important to focus on one thing. And for horses, the investment per animal is super high. So that there we really felt we have a huge impact. So that was our starting point. But that does not mean we cannot go to other animals, to other breeds, to other applications.
For the moment, you're sticking with horses, and you're looking towards, I know you have an office in Berlin, and you also have one in South Carolina.
North Carolina.
Excuse me,
yes.
North Carolina, Charlotte, North
Yes.
Carolina. Talk to me about, who is your target then? I mean, it sounds like you're in Europe, US, kind of all over the place.
Yeah, so we started in Switzerland and Germany and very early with our prototypes already. So we tried early in the development phase to work with our future customers already and get as many inputs and feedback as possible. But then, I mean, the veterinarian field, especially the equine veterinarians, have a very strong network. Okay. So obviously they talk to each other. So then we had customers from the UK approaching us, from Netherlands, from Belgium, from France. And within 1 year, we were in 7 European countries. And
wow.
I mean, obviously that's amazing for us. And we also learned tons in every single country, because every country and every clinic actually works a little bit different. And our vision is to really move forward the whole industry, not only one point, but really rethink and develop this whole level of care that we can provide to animals. And then, yeah, late last year, we were part of the Swiss Next Market Entry Camp, which provides support if you want to go into a new country. And we went to the US actually to find out how this market works and what we need to consider.
What did you find?
Within 3 months, we had 10 clinics who wanted to have the system. So we were like, all right, well, then we go to America now. And yeah, now for 3 months, we have an office in the US and trying to push that huge country and cover that. And it's an amazing journey.
So in the 2 years, more or less 2.5 years that you've had your company, it's really tripled and exploded. I mean, on such a good track. And you've had support from, obviously, from private investors in the beginning, local, more Swiss. And now you have, I think, your second round of support from venture capital in the US, True Ventures. How has your experience with this US investor been so far?
It was amazing. From before we actually closed the deal with True Ventures and took them in as part of our exciting journey there, I was a little bit afraid because you hear all those things about those huge VCs and they're trying to like force you a little bit into a certain direction. And our experience was absolutely the opposite. So they were 100% supportive from day one. They have an amazing community between all the founders. Although I'm trying to connect a lot with Swiss startups as well, I mean, the scene is just not as big, and they have this whole American culture of helping each other, but also being very, very open and honest with barriers and struggles that changed also our culture inside the company a little bit in a very, very positive way.
What is your culture like at your company?
Well, it is, in the beginning, it was very Swiss, I would say.
In what way?
It was very strict and straightforward. And when there was like a target, it had to be done. I mean, that was very, very good in the beginning, because I guess we were one of the few startups that really stick to their plan, and we really actually made it to the market within 1 year of development, which everyone was very surprised about.
You sold out before you started production.
Yes, exactly. Yeah. That was a huge milestone right in the beginning, and also one of the door openers for sure for the involvement of True Ventures. But now the team just got way bigger. So we need to be way more open in communication, exchanging on experiences, involving various parties in decisions, and well, also being open when you mess something up, right? Everyone needs to be aware of that. And that is particularly relevant when you have a more distributed team. And we're still working on that. So that is an ongoing process. And I'm very, very proud of the team that we have gathered around us. And
I love the fact that you've said in previous interviews that you are, when it comes to being one of the few females leading companies and startups here in Switzerland, that you're not focused on just having females be female role models for other females. You know what I mean? That doesn't matter in the sense that, and it's about what you're doing. It's about the device, the subject, whatever it is you're working on.
Yeah, true. I mean, I get the point of having female role models to encourage more girls, ladies to really get started on something that they have in their mind that they're perhaps not brave enough yet, where I can just tell, like, just give it a go. There's nothing to lose, really. But for me, I'm not looking for myself. I'm not looking for female role models. I'm looking for role models. So it doesn't really matter to me that much. I'm just trying to gather as much knowledge and experience from anyone that I feel is more experienced and can share something.
And just to finish up, I want to take you back to the beginning to tell me about that moment, that aha moment that we call it, when you and your co-founder Sasha said, This is something.
Yes.
Yeah.
Well, Sasha approached me with the core technology when I was still at the University of St. Gallen coaching students to found their startups. And the motivation was actually to get more technical expertise, to have the business students in St. Gallen have more access to tech people, basically. And when he presented that technology, I was a little bit like, wow, okay, that sounds really interesting. Like, because the whole vital sign measurements, health was such a huge topic 4 years ago already. And then we got in contact with the animal clinic without really knowing what we want to do there. But we thought, okay, no matter where even if we want to have it for humans, we will have to test it on animals at some point. And then we went to the animal clinic in Zurich, and we both stood there with our mouth open, basically couldn't believe how manually everything is, that people invest hours for a simple measurement. The moment they leave the patient, they have no idea what is going on. And horses were still dying without anyone recognizing it immediately. So yeah, that was really the moment where we said we have a technology that works perfectly for that application, but we also have an industry that is just screaming for innovation. And that was really the moment where we said, okay, we can really have an impact in that industry. It's not about doing something tiny. We also were pretty aware of that challenge, but we felt if we don't try it, we will never forget about that possibility. So there was just no way out but trying to get that done.
And are you a horse person?
I totally became a horse person again. Okay. Absolutely, yes.
All right, well, thank you so much, Dorina, for joining us. It was a real pleasure hearing your story.
Thank you very much. Thanks.